Hi, everybody, and welcome to my GI lecture series. This series is a 10-part series, and it's going to be tailored to medical students who are studying for USMLE Step 1 or COMLEX Level 1. But if you're studying for Step 2 or Step 3, or if you're in a different program altogether, the information you'll find here will be pretty useful. I did this because when I was studying for Step 1, I noticed that I had to find quite a number of resources in order to integrate my knowledge of the GI system. And what I wanted to do is synthesize information from UWorld, First Aid, Pathoma, Boards and Beyond, Sketchy, and a few other resources to give students a sort of one-stop shop to learn the GI tract and learn it in an integrated way. I think too often in medical school, we're thrown a lot of facts that we have to memorize. And by integrating the information, you'll find that it's a lot easier to remember it on test day because you don't need to memorize a ton of facts. You can just know the concept and go from there. So for this first video, I'm going to go over each of the lecture series topics that we're going to discuss. And then I'll also give you a little bit of a rundown of a few GI tract broad concepts that'll be useful in several other lectures. And so those three concepts we're going to go over today are the foregut, midgut, hindgut. We're also going to discuss what the difference is between an intraperitoneal organ and a retroperitoneal organ. And then we'll finish up our talk today by talking about the GI tract layers. So let's go over the 10 lectures that I've been talking about. The first lecture is the one we're in right now. And then after this one, we'll get serious as far as specific organ systems. And that'll include the oral cavity, the esophagus, the stomach, small intestine, large intestine, colon, rectum and anal canal, pancreas, gallbladder, and finally the liver. And to help you out, I know it's a big task to watch an entire organ system in one video. What I'm going to do is I'll also subdivide these to where you can just listen to specific diseases at one time. And I'll also provide timestamps to each video if you're looking for a specific disease within an organ system. Now that we've covered that, let's talk a little bit about the GI tract concepts, starting with the foregut, midgut, and hindgut. So the GI tract is divided into the three regions we're just talked about, the foregut, midgut, and hindgut. And each of these regions has a unique blood supply and a unique set of nerves that innervate it. The reason why they each have a specific blood supply is because if we look back to embryology and a primitive GI tract, the foregut's located here, the midgut here, and the hindgut here. And because they're located in different regions embryologically, they also have different blood supplies that promote their growth. Let's talk a little bit about each of these subdivisions, starting with the foregut. So the foregut starts in the distal esophagus and ends in the proximal duodenum. And it also includes some accessory organs like the liver, pancreas, and gallbladder. So I'll circle essentially where the foregut is in our body, right here on the picture to the right. The artery that supplies this is the celiac trunk, which we'll talk about a lot more in our stomach section. And the parasympathetic nerve that supplies innervation to this region is the vagus nerve. Now moving on to the midgut supplies the distal duodenum, so the last part of the duodenum, to the proximal 2/3 of the transverse colon. So it's essentially this region that I've highlighted here. And instead of the celiac artery, the superior mesenteric artery supplies this region. And again, the vagus nerve supplies the midgut, just as it did the foregut. Our last region, the hindgut, travels from the distal 1/3 of the transverse colon to the upper anal canal, which is highlighted to your right. And this is supplied by the inferior mesenteric artery. And instead of the vagus nerve supplying innervation to this region, we have pelvic splanchnic nerves supplying the innervation. I want to make a point here. We started with the distal esophagus and the up and all the way through the upper anal canal. Keep in mind that the GI tract, the oral cavity, and the lower anal canal have different arterial supplies and epithelial linings. They're technically not part of the embryologic GI tract, but we will go over them in this lecture as we move forward. Here's a chart basically outlining all of the information we discussed so far. I know this section more than others is somewhat rote memorization, and I apologize for that. I promise we have a lot of useful mnemonics and a lot of conceptual ideas coming forward. But for this is important to know. You need to know the arterial supply and the innervation for each of these subsections of the GI tract. So this is important, and this is for your learning opportunity later if you need to look it over. Now we get to move on to what constitutes an intraperitoneal organ and a retroperitoneal organ. So intraperitoneal organs are almost entirely surrounded by our peritoneum, which we'll go over. I have a picture right after this. And these types of organs are mobile, so they're freely moving around. Whereas retroperitoneal organs are only contacted with the their anterior surface is the only part that contacts the peritoneum, and they're fixed. So let me talk about what do we mean by when we talk about intra versus retroperitoneal. So if we have our abdominal cavity here, our abdominal cavity is filled with a fluid called the peritoneal cavity. And within that peritoneal cavity is only about 5 to 10 milliliters of fluid normally. So it's actually quite small, but our organs all start posterior to this peritoneal cavity, okay? Now, intraperitoneal organs are able to migrate into that peritoneum, and they don't actually enter the peritoneal cavity. I want you to think about the organ as if the organ was your hand and the peritoneal cavity was a balloon. So you're trying to push your hand into a balloon without popping it. So this organ will migrate into this balloon without popping it. So it's getting closer and closer, and soon enough, it's almost completely surrounded by peritoneum. Okay. Now, once an organ gets to the stage, you can see right here that there's a double layer of peritoneum, and this double layer is referred to as a mesentery. And a good way some people like to remember the intraperitoneal organs by this mnemonic salted spress. So you can think about all these different organs that are intraperitoneal. Again, I think some of the anatomical mnemonics are not the best, but it gives you an idea of some of the organs that are intraperitoneal. So these organs are freely movable and surrounded almost entirely by peritoneum. On the other hand, let's talk about some retroperitoneal organs. So these organs start in the back, but they don't move up into the peritoneal cavity. They kind of sit where they are. And you can see that only the front surface right here is in contact with the peritoneum, whereas the back surface is just fixed to the wall of the abdomen. So they're immobile. And a mnemonic that's commonly used for these types of organs is the Sad-Pucker mnemonic. And as a good rule of thumb, when you remember mnemonics, I gave you both of these mnemonics, but from a test taking perspective, it's smart to remember one thing and just know that the other thing is the other. So I would pick one or the other of these mnemonics. I like this mnemonic better because it reminds me of some of the retroperitoneal organs. And then I just assume that if it's not within this mnemonic, it's an intraperitoneal organ. So that's one of the good test taking tips that I would recommend going forward as well. Another thing I want to talk about is the two different types of peritoneum, visceral and parietal peritoneum. And this will play a role in a few of our disease conditions, especially appendicitis. So the visceral peritoneum is the peritoneum that surrounds the organ directly, and I'll highlight it in purple now. So you can see it surrounds the organ and its mesentery right here. And this has the same autonomic nerve supply as the organ itself, okay? And what that means is that if you ever have pain in this area or irritation, it's going to be poorly localizable. If you think about somebody who has a heart attack, it's not like they feel that pain directly in their chest, right? It's usually a diffuse pain that you might have jaw pain, you might have stomach pain. it's very poorly localizable. And the same thing can be said for this, because it shares the same nerve supply as an organ, it's very poorly localizable. On the other hand, parietal peritoneum surrounds the abdominal cavity and not the organs. So I'll highlight it in yellow now. And this type of peritoneum has the same nerve supply as your abdominal musculature. And we have all had a muscular strain in our abdomen before after a long run, and you feel that localized pain in a specific area. So it's very well localized. And a common test question or a common disease that they like to highlight this process is appendicitis, where you first have inflammation of your appendix, and so you'll feel this diffuse pain throughout your stomach, kind of near your belly button. And as the disease progresses and the inflammation ends up reaching the wall and the parietal peritoneum that's associated with that, you'll get a very localized pain in your right lower quadrant with appendicitis when it's worse. Now that we've talked about the difference between intra and retroperitoneal organs, let's talk about the GI tract layers, because this will come up in almost every lecture moving forward. So the GI tract has 4 layers surrounding a lumen. And this is true for all of our segments of the GI tract that we talked about, from the foregut, midgut, and hindgut, okay? So we have our lumen, and the layer closest to the lumen is called our mucosa, and just beneath that is aptly named the submucosa. Our third layer is our muscular layer, called our muscularis externa, and then our fourth layer is either our serosa or our adventitia, depending on whether it's an intra or retroperitoneal organ. Okay, and then if you look beyond these layers, that's where we have our visceral peritoneum, our parietal peritoneum. You get muscles, fat, you could have fascia, and then skin. Okay, so let's break down each of these 4 layers now. So our mucosa is divided into 3 different layers itself. We have our surface epithelium that is very close to the lumen. Then we have our lamina propria, and then we have our own muscular layer within this called the muscularis mucosa. Okay, so let's look at a slide just to give a little bit of a rundown of what things look like on a histologic slide. So we have our lumen, and we have our mucosa in this picture. We have a little bit of our submucosa showing here, and we're not able to see the other 2 layers with this, but I have another slide coming up that shows all 4 layers pretty nicely. So if we just talk about the mucosa specifically, I want to break down each of these layers. We have our surface epithelium, our lamina propria, and our muscularis mucosa. So the surface epithelium, the layer that's just closest to the lumen, it's going to be composed of simple columnar epithelium. And we'll see, depending on where you are in the GI tract, it has a few different functions. It's really good for absorption though, and I'll show you a picture of simple columnar epithelium. Simple just means it's not stacked against each other, going up and down. So there's not like columnar cells right here. And then columnar makes sense because they look like column shaped. The lamina propria has a lot of different functions. It has immunologic function as well. I like to think of it, I think the most important organ that we're going to see the lamina propria play a part is the stomach. So this is going to be from our stomach section, where it actually produces quite a few different glands in here. And I'll just give you a little rundown of what kind of substances can be produced within the lamina propria in our stomach. And we'll go over this in great detail during that lecture, but I just kind of want to give you a rundown right now. And finally, the muscularis mucosa, it's a muscular layer, so you know muscles contract, and it's really low yield. You don't really need to know this, but the contractions actually can promote gland secretion, which I thought was kind of interesting. So moving on to the submucosa. The submucosa contains a nerve layer called the Meissner's plexus, or the submucosal plexus. And what this does is, and I drew it in right here, and what this does is it actually facilitates secretions into the GI lumen from our GI tract. And a good way to remember this is just remember all the S's. So the submucosal plexus or Meissner's plexus gives you secretions. And again, if we look at the submucosa, you have a plexus within that mucosa, and that facilitates secretions out into the GI tract. Moving on to our third layer, our muscular layer. It's our third layer, and it has 3 different structures you need to know within it. So you have an inner circular muscle layer, which I'll draw now. Next you have the myenteric or Auerbach's plexus, which serves a couple really important functions. This is probably the most important structure to know within all of the GI tract layers because they love to test this in a few different conditions. What this plexus does, which I've drawn right now, is it can do a couple things. First off, it regulates our contractions. And I think about that by myenteric, the M in myenteric, I think about the M in movement. It keeps things moving along our GI tract. And then you also have an outer longitudinal muscle layer, which is here. And one thing I want to point out, I mentioned that there's 2 things that it does. It also regulates sphincter tone, which we'll see in achalasia. This is a histologic section that shows all 4 layers of the GI tract, which is kind of nice. We have our lumen here, we have our mucosa, our submucosa, our muscular layer, and then the serosa or adventitia. So we're talking about the muscle layer here. You can see the inner circular layer. Here's the myenteric plexus, which regulates our contractions and also helps with sphincter tone. And then we have our outer longitudinal muscle layer. And something that's kind of interesting about these muscle layers, you can see that the inner circular muscle layer has its fibers running left to right in this photo, whereas the longitudinal layer has the fibers running out in and out of the screen. So these muscle layers are always perpendicular to each other if you're trying to find out where you are on a histologic section. Our last layer we'll talk about is the serosa or the adventitia, and it's the outermost layer of our GI tract. It's named the serosa if it's surrounding any of the intraperitoneal organs that we saw earlier, like the stomach, the liver, the appendix, the small intestines. And I remember that by the serosa is for our sliding organs. Remember, the intraperitoneal organs are mobile, they can slide around and kind of do whatever they want. On the other hand, the adventitia is the 4th layer of our retroperitoneal organs, like our kidneys, our adrenal glands. And I remember that by our adventitia is the 4th layer for our attached organs. And if we look here, we can see the 4th layer. And there's another reminder that the serosa is for intraperitoneal or sliding organs, and the adventitia is for attached organs. I know this specific lecture wasn't the most exciting and groundbreaking thing, but I do think you'll find if you continue on with some of the other lectures in the series, I think you'll find quite a few of them to be of benefit as we move forward. But I'm always looking for feedback, so let me know if you think I can improve in any way on these lectures, and I'll see you at the next one.